Good afternoon, this is Dr. Do again. This video is the Quarantine Special Edition, video number 8. Today I'm going to talk about a probably common, or probably you're not sure, a symptom called tinnitus, or you can call it tinnitus. English pronunciation, if regular common word, probably the accent on the third one, so tinnitus. But a lot of medical words, the accent changed, so this is in medical field probably called tinnitus. But you can call tinnitus or tinnitus, your doctor will know. What is tinnitus? It's hearing the buzz or the sound or the screaming in your ear. It probably is tinnitus, probably it's not. Probably it's psychologically voice, or probably just your voice from the heart. It's something you really wanted, or you really concentrate. Probably the voice start to in your heart, in your brain, then transformed into your ear. Or you thought you were hearing something. There are a lot of kind of in our daily life. We have so many things going on. You probably have those kind of symptoms like hearing a buzz or screaming occasionally. For example, during the weekend, you partied, you drank, and you couldn't sleep well, or you overslept, and next morning when you get up, you feel like, oh my God, there's something in my brain, in my ear, either buzz or screaming, and then it goes away, or it goes away by itself, and nothing bothers you anymore. This is normal. You don't need to worry about it. Okay? Or if you, like I said, you have something holding your mind very tight, and you feel like somebody's talking to you, go get it, study hard, working hard, either probably your mom's voice, or probably your friend's voice, or probably from your own self. And this I've not considered this is abnormal. This is inspirational, and is a driving force for you to work hard, which is good. And there's another, it's called psychological voice. You hear somebody talking to you, not objectively. Nobody's there. You're in the quarantine. That's why I take this as a quarantine special. You're in the space by yourself, alone. You feel like, I hear somebody's talking to me. Either whispering, or either calling, or either cursing. This belongs to the category of psychological. So that's not what I'm going to talk. I'm going to talk about you really feel, hear screaming, buzzing from your ear. Okay, and it does not exist. If you ask people around you, did you hear, the buzz or the screaming, and they say no, then if you hear it, that's called tinnitus. What kind of causes etiology for the tinnitus? For the young people, usually not quite common. Okay, actually not worry too much unless it bothers you that much. Bothers you a lot. Usually for the young people, there's a disease called Meniere's disease. You feel dizzy, you feel your ear was screaming, buzzing, and sometimes associated with pain. This disease is just the imbalance of the lymph inside of the ear. Okay, if that's the case, you need to see a physician. Okay, basically they treat you symptomatically. There's no radical treatment. You just wait. When it comes, when it occurs, you talk to your physician, and then they will either put you rest or give you some medication to relax, and to the buzz or the screaming will go away. There's another cause for the young people. It's called neuritis. The nerves responsible for the hearing is under the inflammation, either viral or some other causes. Regardless of the cause, if you have this, you go to see a physician, they will check it, they will tell you it's going to be recover by itself, or you're going to be put on the medications, either some steroid or just some other medication, symptomatically management. For the older people, if you have the symptoms, I think it's probably the causes might be serious, like the ischemia, okay, the stroke, the leukemia, which means the small blood vessel undergoing ischemic clotted, you do not know. So if you, like I said, no matter how you're old or you're young, if you have this buzz or screaming, and just for 1 day or a couple hours or 2 days, it's gone. It went away. For the young people, it's okay, but for the older people, it's good idea to check it, even though it goes away. Still to check it, make sure there's no organic disease like a blood vessel problem or nerves problem to cause it, because especially for those who have high blood pressure, diabetes, obesity, hyperlipidemia. So as we talk along, you know, this metabolic syndrome really pose risk to many conditions. So like I said, if you have those problem and you sudden or gradually you feel you hear the screaming or buzz or tinnitus, you need to call your physician to make sure, check it out, no ischemic or any problem to cause that. So then that will really relieve for yourself, and also if physician knows, and they will prescribe medication or do the imaging study to exclude any organic disease. So then you know how to relax for the later on. All right, so this is the quarantine special video number 7, tinnitus, and thank you for tuning in, and your feedback is highly appreciated. Thank you.